Well, I made that decision when I did my third year medical student rotation and surgery. So I just loved the fact that you can make a difference in people and you can see the difference almost immediately. It's just, I was immediately attracted to this specialty. Bariatrics because, again, during my residency training, I've assisted on these cases. We used to do them in an open fashion. And I noticed the dramatic difference that these weight loss that can do to people and how their whole approach to life changes. Then you can tell that they immediately get rid of their diabetes, their high blood pressure gets better, their joint pain is improved, they don't have to take a lot of medications. So it's just this dramatic impact that I see. I always like this kind of thing that I could make a difference in people's lives, and it's obvious. Our bariatric program, we're proud to be the first hospital in Kansas State to do weight loss surgery. This was started by Dr. Bowman and Dr. Stevens, and they did a lot of gastric bypasses. I joined the team in August of 2007, and I introduced the minimally invasive techniques to do these procedures. And our practice covers basically more than 99% of the weight loss procedures performed in this nation. That varies from gastric bypass, gastric sleeve, and as well as banding. Our program, we're proud of our program because we're very kind of family-oriented. I do everything by myself. I see the patient preoperatively myself. I do their endoscopies and I do their surgeries myself, and I check them on their post-op visit by myself. If I do a band on a patient, I do the adjustment myself. So this is the kind of our program is strong with that. Our program does not just include the surgical part, it includes the post-op part. And our dietitian is reachable 24/7. So we go over not just the surgery part, the nutritious part, the vitamin part, and certainly the exercise part. We have a support meeting every month that include pre-op patients as well as patient who has post-op, and these are one of the best things that the patients can do. So our program basically covers everything from preoperatively, intraoperatively, post-op, as well month, years down the line. We have patients that we see them 10 years later, and we're proud of that. My philosophy of care is pretty simple. I tell my patients I'm going to give you an A+ approach in the sense that you're going to get an A+ procedure. However, I want you to give me also an A+ effort on your behalf. We've been doing this for a long time, and I think, and I've noticed this over all the years that I've been doing this, that the more the patient listens to what we say, you can tell which patient has done that and which we cannot. So that's simply my philosophy when it comes to approaching patients and life, actually. I love what I do because it's, again, I can see change in people's life. And not all specialties you can notice that this immediate change, and people get healthy. It's just amazing the difference that you can make in people's life. Surgery is not a panacea. Another philosophy of mine is that I don't like to sugarcoat things. Sometimes people say I'm kind of a little bit blunt, but I like to point out things the way they are. It's an invasive procedure, and I want them to get the best out of that invasive procedure. So my advice to them is to ask me as much questions as they can. It's important for me my patients to be very well educated about these procedures. So for me, it's really important about the education part, contact with the face-to-face with the patients. Most of the time they have family member with them. I like their husbands or wives to be included, and because it's important for them to get the good support after the procedure.